Hi, my name is Sandra Mason. I'm a nursing student at the University of South Alabama, and today I will be doing my injection sites for whenever I administer medications to patients. Here is my student ID. You'll scan the room. So to begin, I've already applied my clean gloves. So the first injection site that we will find is the deltoid. So to locate this, you will find the acromion process, which you can find by rotating the patient's arm, and it's located up here at the shoulder. So once you find this, you would want your patient's arm to remain relaxed during the injection. So once you find the acromion process, you would place 3 fingers below the acromion process, and when you do the injection, you want to make sure that you do not go below the deltoid insertion of the humerus. Once you find the place under the acromion process, you would form a V with your fingers, and you would do the injection at a 90-degree angle this way because it is an intramuscular injection. Next would be the dorsolateral aspect of the arm. So to find this location, you would start with the deltoid insertion of the humerus. You would not go above the deltoid insertion of the humerus for this injection, but when you find that spot, you would place 3 fingers below the insertion, and you would locate the spot above the elbow and apply 3 fingers above the elbow. So the location for the injection would be on the lateral part of the arm, so it would be on the back side, and you would do this injection subcutaneously. So you can do this injection at a 45-degree angle or a 90-degree angle, depending on the size of the needle and also the amount of tissue or muscle in this on the back lateral portion of the arm. The next site would be the subcutaneous abdominal site. So for this, you want to make sure that you stay within 2 inches of the umbilicus. You would also make sure that you do not go above the costal margins or below the pubic region. And you would also want to make sure that you do not go outside of the inferior or superior iliac spine. So this site would make a U shape. And when you're doing a subcutaneous injection, you can do this at a 45-degree angle or a 95-degree angle, and this is the preferred injection site for a subcutaneous injection. The next site is the ventrogluteal. So in order to find this, you would locate the greater trochanter. So at this time, the patient would be laying down, and they would be facing me, but for the video, we are going to be doing it with him standing up. First, you would locate the greater trochanter of the hip, and you would locate this by getting the patient to move their leg to find the greater trochanter. So once you locate that region, you would apply the ball of your palm onto the greater trochanter with your thumb facing towards the pubic region, and the index finger facing towards the inferior superior iliac spine, and the middle finger towards the iliac crest. So once you locate that, you will find this V area, and this is where your injection site would be. So you would want to palpate this area, and since this is a intramuscular injection site, you would go here at a 90-degree angle. So next would be the vastus lateralis injection site. So this would be located on the thigh. So in order to find this, you would locate the greater trochanter of the thigh or of the leg. So once you locate that greater trochanter, you would put 1 hand's length below the greater trochanter and 1 hand's length above the knee. So when you locate this area, it forms a rectangular shape. So this injection site is intramuscular and subcutaneous. So you can either go at a 95 or a 90-degree angle or a 45-degree angle. So with this injection site too, you want to make sure that you stay within the 1/3 region of the thigh, and you would also want to make sure that you do not go past the midline of the thigh or the lateral part of the midline of the thigh. And that concludes the injection sites. Thank you.